What is osteoarthritis? It is a degenerative joint condition that occurs over time. As we use our joints throughout our lifetime, we get a lot of wearing and tearing, and over time, the cartilage, which is the cushioning between the joints, is going to rub and wear down. As that wears down, we start to get more of that bone-on-bone approximation, and that's where the arthritis is going to come in. With osteoarthritis of the knee, it is very common for all the muscles surrounding the knee to be tight as well. So we're going to go through a couple of stretches to help you stretch out those tight muscles. The first one we're going to do is a hamstring stretch. We're going to do it in what's called a long sit position. So I'm going to have my patient come to a long sit position, extend one leg straight out. For comfort, you can rest your other leg off the table. He's going to pull his toe back toward him, make sure his knee is nice and straight, and then keeping his back flat, he's going to hinge forward at the waist and feel that stretch in the back of the thigh and the back of the knee. He's going to hold this for 20 to 30 seconds, and he's going to do it 3 times on each side. Another muscle that is commonly weak when you have osteoarthritis of your knee is your hip flexor. Those are the muscles that lay in the front of your hip. And then in combination with the quadriceps, we're going to do what's called a straight leg raise. So I'm going to have my patient bend up his opposite uninvolved knee, and that's just to take pressure off the back. He's going to start with a quad set. So he's tightening those thigh muscles, pushing the knee back down into the table, and then keeping that quad set nice and tight, he's going to lift his knee, his whole leg up toward the ceiling, and then slowly bring it back down to the table. And with this exercise, you want to use caution and make sure you're not lifting too high. You don't want to lift any higher than your opposite knee. Make sure you're really squeezing that thigh nice and tight to get that good quad quality. With arthritis in your knee joint, it's very common for your quadriceps, which are the muscles in the front of your thigh, to get very weak. So we are going to show you a basic strengthening exercise to activate your quads. It's called a quad set. What you can do is take a little towel and just roll it up, and then you're going to extend your leg over top of the towel. The towel's going to go underneath your knee. And then you want to take your thigh muscles, you're going to squeeze them tight and then push the back of your knee down into the towel. So you're activating those quads, extending the knee as much as you can, and you want to hold this for 5 to 10 seconds and repeat this 10 to 20 times. You can see as the patient activates his quads, extends his knee, you can see his kneecap slightly moving up. And that's because the quadriceps acts as a pulley with your patella to pull the kneecap up. Working through a larger range of motion to activate the quadriceps, we're going to do an exercise called a long arc quad. So you can sit on the edge of a chair, and we're going to take your leg, we're going to extend it straight out. Squeeze those thigh muscles so you're getting that nice quad contraction. You want to hold for 5 seconds at the top, and then slow and controlled lower your leg back down. We're going to do 2 sets of 10 of these on each leg. To isolate out the quadriceps in a smaller range of motion, we're going to do what's called a short arc quad. So you can take a towel or a pillow or blanket, roll it up underneath your knee, and then you're going to activate your quads by squeezing your thigh, lift your leg up. You want to hold for 5 seconds at the top, and then slowly return your leg back down to the table. My patient's going to do 2 sets of 10 of these on each side. 2 other muscles that are very commonly tight with our osteoarthritic patients, especially with the knee, are your 2 calf muscles. So the first muscle that we're going to stretch out is your larger calf muscle called your gastrocnemius. So to stretch this muscle out, you want to make sure that your leg is straight, that your knee is straight, so you're getting the full extensibility of the stretch. So my patient is going to extend one leg out, and he's going to use a gown to help him. Now you can use whatever you have at home, a stretching strap, a towel, a scarf, a belt loop, a dog leash, whatever you have. You're going to loop that around your foot, and then keeping your knee straight, you're going to pull your foot back toward you till you feel that stretch in the back of the calf. He's going to hold this for 20 to 30 seconds, and he's going to repeat it 3 times on each side. The second calf muscle that we're going to stretch today is called the soleus. This is a deeper calf muscle. It sits underneath your larger calf muscle called your gastrocnemius, and it does not cross the knee joint. So to isolate this muscle out, I'm going to have you extend one leg out, and you're going to bring your knee into a slightly bent position. Then we're going to get our stretching strap, loop it around your foot, and then pull your toe back toward you. So that slight bend in the knee is really helping to isolate out the soleus muscle, which sits a little bit lower down in your calf. He's going to hold this for 20 to 30 seconds and repeat it 3 times on each side. There isn't any cure for arthritis, but it is very easily manageable with physical therapy. So one thing that we'll do in physical therapy is we will do hands-on joint mobilization. So that is making sure that the bones are sliding and gliding the way that they should, decreasing some of that stiffness in the joint, bringing some of that joint nutrition back in, giving a little bit more lubrication in the joint so you're not feeling as stiff and painful. For more information, call our office at 703-450-4300 or click the link below.